Welcome back, everyone, to Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Today we have a special guest, Perry Chan, with the county's Asian American Health Initiative. Welcome, Perry, and could you please introduce yourself?
Sure. Hello, everyone, and thank you for the opportunity to be interviewed today. My name is Perry Chen. I'm the Program Manager at the Asian American Health Initiative in the Department of Health and Human Services in Montgomery County. I look forward to having a conversation with you today and introduce the AHI to everyone this afternoon.
Excellent. Thank you, Perry. I know you have a wonderful presentation to share. So let's get going. Thank you, Perry.
Thank you, Lally. My pleasure again to introduce the Asian American Health Initiative to the viewer. And this is the slideshow that I wanted to use for today's presentation. What we are going to go through is we are going to introduce the organization overview. We are going to talk about some Asian American demographic, the barrier faced by Asian American, as well as health needs. And then at the end, I would introduce the work of AHI to all of you. The Asian American Health Initiative, as I indicated, is a part of the Montgomery County Department of Health and Human Services. We are housed in the Office of Community Affairs with the support of my chief, Ms. Betty Lam. Our role is to support the entire department to make sure that our work and services are culturally and linguistically competent. And our partners within the Office of Community Affairs, including the African American Health Program, the Latino Health Initiative. We are playing a similar role for our department in the community, but our strategy are very tailored to the target population that we want to serve. And we will go over why by looking at the data. The Asian American Health Initiative's mission is to improve the health and wellness of Asian American communities in Montgomery County by applying equity, community engagement, and data-driven approaches. First of all, I wanted to ask you, who are Asian Americans? To us, Asian American is a self-identification term. At the same time, we don't use it to determine any residence qualification for services. This is just a target population that we keep in mind when we do planning and implementation as well as evaluation. Asian American is a very diverse community coming from over 50 countries. They all speak different different languages. We have different cultures, religions, traditions, etc. And in terms of language, it's also very diverse. In the Asian American communities, there are more than 100 dialect and languages spoken for these community members. Looking at the demographic, Asian American is one of the fastest growing community in Montgomery County. In 2015, we account for about 15.1% of the county population. And about 40% of Asian American in Maryland lives in Montgomery County. And this is a very interesting graph that guide our work. The biggest group of the Asian American community county are Chinese, Asian, Indian, Korean, Filipino, and Vietnamese. What makes our job interesting and sometimes challenging too is this Asian and further break it down to Pakistani, Japanese, Taiwanese, etc. So we are talking about a very, very diverse group. Again, we don't have one common language that we can speak across the board. So when these are the demographic that we need to keep in mind when we serve Asian Americans. Looking at the female and male ratio is about 53.5 versus 46.5. And looking at the place of birth, most of the Asian American community members in the counties are foreign born. And between 35 to 54 are the largest group within Asian Americans for the age distribution. Some of the health concerns for Asian Americans are including the model minority myth, and then we are going to look into some barriers faced by Asian American as well as needs of Asian Americans. What is model minority myth? Pretty much it is a false belief and narrative that Asian Americans are wealthy, healthy, there's no problem in this community does not need help because they are so successful. This is a stereotype and misconception. First of all, not Asian American are the same. Some Asian Americans are successful in life. They are able to pursue American dream. They have high education achievement, high income, but it's not everyone. Not that everyone are able to be self-sustained to survive in this country, and this misconception and stereotype becomes very challenging in the work of health and human services because people have the mindset that this community do not need help. So it also affects someone individually because it hinders their seeking help behavior, and it also make some community member feel pressure when they are going out to get public assistance. They feel, oh, other people are wealthy. Why am I relying on some support from government and nonprofit? It adds an extra layer to the challenge when we serve the Asian Americans. Other social determinant of health that becomes the barrier for Asian Americans, including what we call LEP, limited English proficiency, health insurance status, education attainment, and immigration status. For limited English proficiency, we know, as I said before, a very high number of Asian Americans are foreign born, and in Montgomery County, about 30% of Asian Americans speak English less than very well. What does it mean? It means that this group of people may have difficulties in understanding and navigating the health and social services system. They may need language assistance when they go see a healthcare provider. They may need some language support when they apply for social services. That including, the application form in multiple languages, the understanding how the application will be processed, what documents that they need to provide when they apply for any services. So language would be one of the things that we are looking at the Asian American Health Initiative. Same thing with health insurance status. And about 5.8% of Asian American in Montgomery County have no health insurance. And uninsured is probably one of the biggest challenge when we talk about healthcare access. But at the same time, having health insurance, people who are insured, we may also need help on navigating into the healthcare system and know how to use healthcare, know how to make an appointment, know how to use health insurance, understand the health insurance terminology, what is copay, what is deductible, etc. Education attainment. About 19.3% of Asian Americans over age of 25 in Montgomery County have high school diploma or less. So this is one of the data that dispel the model minority myth that all the Asian Americans are highly educated, they are doing good. I think what we need to do is to look into the subgroups, and we need to look at Asian American with an open mind. Immigration. almost 70% of Asian Americans were born outside the United States. What does it indicate? It may means that this group of people have less understanding of U.S. healthcare system and social services system. They don't understand the importance of preventive care. They may not know where to seek help when they are needing for some sort of a support like food stamp or utility assistance that can help them survive in the county. There are other determinants: disability, poverty, etc. So looking at the disease condition, cancer is the first leading cause of death for Asian American versus the rest of the American. Heart disease is the first leading cause of death. Asian American also have a very high diabetes rate um, in the community compared to other ethnic groups. Hepatitis B is a unique challenge for Asian Americans. Osteoporosis is also put Asian American at risk because it is also one of the silent diseases that we see in the community. TB, heart disease, senior health, and mental health, those are the disease conditions that make Asian American at a high risk for certain disease condition. So how is AHI responding to these healthcare needs, challenges, and barriers? So we have 4 core works area that guide us to tackle all these challenges. They are community engagement, community empowerment, capacity building, and change catalyst. Community engagement is a lot of our outreach work, one-on-one, providing education, engaging the community to educate them what is out there when they need help, where to get the help, and how. For community empowerment, we have a group effort to empower the community together by organizing workshop, providing mental health first aid training, providing technical assistance to our community-based partners so that they can serve the community with us and provide advice and technical assistance to provide just hospitals and other programs at the local government, state government, federal government. Capacity building is for us to build a lot of tools and models and that are culturally and linguistically competent for the needs of Asian Americans, such as our mental health project and our senior wellness initiative where we would do some activity at the senior center for the Asian American older adult. All this work come together. We want to make a change in our system. That is our ultimate goal. So we also work with a group of advisors who is providing advice, assistance, and advocacy to the Asian American community. They also give us inputs and guidance, what we should be looking at, what are the needs in the community. This group is our Asian American Health Initiative Steering Committee. They function very, very effectively and efficiently. In the context of COVID-19 now, we are working together almost on a daily basis. They are the volunteer from the community. They understand the struggle of our community and they want to help. Here are some way for today's presentation. Remember, Americans are diverse. We should avoid one-size-fits-all approach when we work with Asian American community. Do not influenced by the model minority myth. It is a stereotype. It is a misconception. And the Asian American Health Initiative is here to help you. If you have any question, if you want to create some programming that are culturally and linguistically competent for Asian Americans. And thank you. And next I will be navigating and introducing you to the Asian American Health Initiative website, where you will be able to find more tools and information.
Thank you, Perry. That was an amazing presentation. And I know for many of our viewers, they have actually learned something that they weren't expecting. So here we are on the Asian American Health Initiative's website. Would you now step us through so folk can better understand current programs, events, and what they can access on a day-to-day basis? Thank you.
Absolutely. Thank you, Lali. Welcome to the Asian American Initiative. This is our home base. So on this website, we have different resources and tools and information that many community members are looking for. So for example, our recent work related to COVID-19 is that doing some assessment in the community, what other community-based partners are doing to serve in order to coordinate and to be efficient. We are publishing the work that they do so that we coordinate support. We are we are providing a platform for community partnership. So this is one of the example of our work. One thing that I wanted to point out is the work that we do is done by our amazing AAHI staff. So let me introduce the team to all of the viewer. This is myself and my colleagues, Sanjana, Jasmine, Sammy, Sophia, and Elsa. Please check out their bios and email them. They would love to connect with all of you in many different and our work cannot be as successful as we are today with guidance and input and support from our steering committee. These are the community leaders. As I said, they are responsibilities to assist and advocate for the Asian American community. They meet with our county official regularly. They have communication with them regularly. If you are interested in joining this team, please come to our website and it would tells you how to apply. I already go through the work that we do and who are Asian American. I wanted to go to the resource page, and these are the tools that we are producing and creating, and we want to share with our community. This is one of the mental health storybook, that photo novel that we produce for the community in multiple languages. And the reason I wanted to point it out is these are the booklet. Not only we're not only putting the PDF there, but we are also putting the original file with the translation on the website without copyright. We purposefully want to do it in a copyright-free format so that we can encourage partners to adopt it, download it. All they need is take pictures from their phone and insert it to this publisher file. You can create your own community photo novel to talk about mental health. We also have different toolkits for mental health, different osteoporosis, how to navigate the health and those services system. These are the things that directly responding to the barrier and disparity that I was mentioning earlier in the presentation. And the AAHI Blueprint is the latest publication that was launched in March 2020. And it is for us to guide our work for the next 10 years. So if you are interested in knowing, what are the priority areas, why what we think, this is the best publication. And these are the reports that we have. We are trying to make our work be as transparent as possible. We are listing all the accomplishments and our so we have a very good communication with our partners. we have successfully establishing hepatitis B model for Montgomery County that serve Asian Americans. We have it in Filipino community, for Korean community, Chinese and Vietnamese community as well. There are other health and human services information and guide on this website. So again, you are invited to come to this website and take a look and leave us some comments. And as I point out in the PowerPoint slide, one of the key value for us is to make our work to fully competent, and our website is no exception for that. What we do is our website is all available in multiple languages, Chinese, Korean, Hindi, and Vietnamese. So, and these are the translation all done by human. We hire a translator to make them happen because we value language access. And this is not just computerized or robotic translation. After having an exploration of our website, the last thing I would encourage you to do is contact and stay in touch. In addition to this website, we also engage the community by using social media, including Twitter, Facebook, and YouTube. Our phone number and email. I very much look forward to talk to you in a personal level.
Perry, thank you once again for being here today. It's so educational every time I learn more about the Asian American Health Initiative.
Well, thank you, Lai, for this opportunity, and it's a great platform for us to share our work. My pleasure to run through a couple slides with all the viewers today very quickly and do an introduction of our website. I know this is only a starting point. As I said, I look forward to contacting and continue to engaging with all the viewers and to partner with all of you. And thank you again for this opportunity.
Excellent. And just to remind everyone, I will put the Asian American Health Initiative's website on Engage at Home, so you can easily just click and enjoy learning all about the resources. And most importantly, at the moment, see some of those updates in relation to COVID-19 and how Perry and his team are collaborating with the Asian American community here in Montgomery County. So that's our show. You have been watching Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Go well, keep safe, and keep calm.